There are also a lot of cases of something called as breast implant illness, which is also called as Asia syndrome. Is it something that's also seen in India, and how is the awareness about that in India?
There is awareness about it, and that is why often patients request us they want to go for fat grafting instead of silicone based implant. But let me tell you that today the incidence of anaplastic small cell lymphoma is very, very less, because we are using fifth generation silicone implants and using smooth implants. Initially, it was more associated with textured implants, which are a textured surface. Now, most of the implants, incidence is very, very low, maybe 1 in 30,000 patients or so. And once the patient is in pickup, then it can be detected and it is treatable. So yes, those patients who still fear can go for fat grafting. Breast augmentation is the most common procedures done even in cis women.
In case a patient has had breast implants for quite some time and they want to get it removed at a later age of their life, there is going to be a certain kind of disfigurement. Is there any option for them so that their skin is okay and not disfigured?
See, this is true for both natal women as well as trans women, because in natal women also there is an incidence, and in certain countries considered 1 in 4 women will probably undergo breast augmentation. That is a very huge number. So yes, this is true for both natal and trans women. And if the implant has to be removed for some reason, there is disfigurement, loss of the projection of breast tissue, and we have to tide the patient over for that period when the wound heals. And after that, patient can undergo either fat grafting or reimplanting if the patient so desire. In that period, the help of padding, the changes which can tide the patient over the period.
And is there any surgery like PLEP or something that can help to tighten the skin?
Yes, mastopexy is a surgery which can tighten the skin, and especially if there is a loss of perkiness of the breast, if there is a ptosis of the breast, then mastopexy can be very useful to not only to augment as well as to raise up the breast and the nipple areola construct to the correct site. So yes, that can be done.